Let's talk about vitamin D and the role it plays in our fertility health. Vitamin D is one of our fat-soluble vitamins, but truthfully, it acts almost more like a hormone than it does a vitamin. Because it's fat-soluble, it does have the ability to be stored in our bodies, which is why we always say there is such a thing as too much. This is also why it is so important to test our vitamin D levels. Testing tells us two things. One, where are your levels? So are they sufficient? Amazing. Are they deficient? Okay. The second thing is it's going to help dictate how much is prescribed to you in order to correct the deficiency. If your levels are very deficient, the standard dose of 1 or 2,000 IU a day will not be enough to actually bring those ranges up into sufficient levels quickly enough. Now let's get into the research behind fertility and vitamin D. Vitamin D has been linked to less ovulatory cycles, and we know when we are trying to get pregnant, if we are not ovulating, we cannot get pregnant. Deficiencies have also been linked to an increase in pregnancy loss, meaning it is now a known risk factor for miscarriage. We've seen lower rates of success with IVF patients when they do not have adequate levels of vitamin D. Vitamin D deficiency also impacts our thyroid health, and we have research to show that it can increase thyroid antibodies, like in the case of Hashimoto's, when we have lower than optimal vitamin D levels. Vitamin D deficiency has also been linked to worsening insulin resistance. Insulin resistance can be paired with PCOS, but can also occur independent of a woman having PCOS. Vitamin D deficiency has also been linked to various cancers, cardiovascular disease, brain health, and a whole bunch of other things. So it's one of those vitamins that is very important to have tested so that we are correcting and optimizing to not only benefit our fertility health, but making sure that we are optimizing our health on all fronts. Follow along for more fertility tips.